Celiac disease. What is celiac disease? So, celiac disease is a mucosal disorder. It's a myriad of disorders affecting the mucosa of the small intestines. Because the small intestines is the principal site for digestion and absorption of nutrients, a deficit in the area has the potential of causing malabsorption of fat, protein, carbohydrates, vitamins, and minerals. Celiac disease, also called celiac sprue, is characterized by intolerance of gluten, a protein, and wheat products. Current research suggests that celiac sprue is an immune disorder triggered by exposure to gliadin, which is a specific wheat gluten, in genetically predisposed people. Environmental, genetic, and immune factors play pivotal roles in determining the nature of the symptoms. The onset may present in infancy when gluten-containing products are first introduced in the diet, but is more common in the 4th and 5th decade. Here I've uploaded a video to further explain celiac disease.
Gluten and celiac disease, from NIH Medline Plus magazine. Gluten, it's all over the news. But what is it, and where can it be found? Gluten is a protein. It is found naturally in some grains, such as wheat, barley, and rye. Nope, not you, rice. Common food products that have gluten include pastas, cereal, and bread. Sometimes gluten can also sneak its way into products like vitamins and supplements, lip balms, and some hair and skin products. Shh. Most people don't have a problem with gluten, but some people can't eat it because of an autoimmune disorder called celiac disease. The gluten makes them feel sick. Celiac disease sometimes is hereditary, meaning it runs in families. It's also very common. As many as 1 out of every 141 people in the United States has celiac disease. But most people who have celiac disease don't even know they have it. In celiac disease, gluten can trigger the immune system to attack the small intestine. Immune cells damage small, finger-like growths in the small intestine called villi, and the brushy intestinal lining becomes flattened. When the villi are damaged, the body can't get the nutrients it needs. The immune system's reaction can lead to other health problems as well. Symptoms of celiac disease in adults may include headaches, depression or anxiety, tiredness, bone or joint pain, and a very itchy skin rash with blisters called dermatitis herpetiformis. And in children, stomach pain, nausea and vomiting, slowed growth, and delayed puberty. If untreated, celiac disease can lead to serious complications like anemia, infertility, and weak and brittle bones. Celiac disease can be difficult to diagnose because it looks like many other diseases. If your doctor thinks you might have celiac disease, you may need a blood test looking for antibody markers like TTGA and EMA. The diagnosis can also be confirmed with a biopsy. A tiny tissue sample is obtained under anesthesia using a thin tube called an endoscope. The good news is there's a treatment, following a gluten-free diet. Patients need to learn what to eat and what to avoid, and to read nutrition labels carefully. For most people, following this diet will fix the symptoms and heal damage to the small intestine. But for some people, diet alone doesn't work. Finding hidden sources of gluten you may still be eating or using can help. Through the National Institute of Diabetes and Digestive and Kidney Diseases, the NIH supports research to learn more about celiac disease. Find out more about celiac disease and other topics at NIH Medline Plus, the magazine, medlineplus.gov/magazine. You can also search online.
Anatomy with and without celiac disease. Like the video we just watched spoke on, the main pathologic findings is the villus atrophy with a decrease in activity and amount of surface epithelial enzymes. When someone with celiac disease eats something with gluten, their body overacts to the protein and damages the villi, these small finger-like projections found along the wall of the small intestine. Celiac disease symptoms in adults. The signs and symptoms of celiac disease can vary greatly and differ in children and adults. Digestive signs and symptoms for children include diarrhea, fatigue, weight loss, bloating and gas, abdominal pain, nausea and vomiting, and constipation. However, more than half of the adults with celiac disease have symptoms and signs unrelated to digestive system at all. Anemia, usually from iron deficiency, loss of bone density, itchy, blistery skin, mouth ulcers, headaches and fatigue, nervous system injury, including numbness and tingling in the feet and hands, possible problems with balance and cognition, joint pain, and reduction of the function in the spleen. Some of the symptoms we might see in children with celiac disease. Children are more likely than adults to have digestive problems, including the nausea and vomiting, gas, pale and foul-smelling stool, chronic diarrhea, swollen belly, and constipation. The inability to absorb nutrients might result in the failure to thrive for infants, damage to the tooth enamel, weight loss, anemia, irritability, short stature, delayed puberty, neurological symptoms including attention deficit hyperactivity disorder or ADHD, learning disabilities, headaches, lack of muscle coordination, and seizures. As we've seen as a symptom in adults, dermatitis herpetiformis or DH is a severe chronic skin rash associated with celiac disease. The symptoms of dermatitis herpetiformis are extremely itchy and blistering skin, sometimes referred to as a gluten rash or that celiac rash. DH is a chronic condition that is considered to be the skin form of celiac disease. Not all people with celiac disease develop DH. The rash usually occurs on the elbows, knees, buttocks, and typically symmetrical, meaning that it appears on both sides of the body. When this gluten-related rash goes away, which it often does spontaneously, it may leave some brown or pale marks on the skin where pigmentation is lost. The resulting malabsorption of ingested nutrients may promote malnutrition and severe debilitation. Celiac disease often suffer from deficiencies including vitamin D, B12, iron, calcium, copper, folate, magnesium, riboflavin, and zinc. Celiac disease prevalence. Celiac disease affects twice as many females as males, and many have familial inheritance patterns. More accurate serologic tests have shown the incidence in the general population to be much higher than previously believed. Primarily, celiac disease affects those of Northwestern European ancestry. Prevalence of celiac disease in the United States. So an average of 1 in 133 have celiac disease. People with related symptoms to celiac disease are 1 in 56. People with first-degree relatives like a parent, child, or sibling who have celiac disease are 1 in 22. People with second-degree relatives like an aunt, uncle, or cousin that have celiac disease is 1 in 39. An estimated prevalence of African, Hispanic, and Asian Americans are 1 in 236. In the landmark prevalence study on celiac disease, investigators determined that 60% of children and 41% of adults diagnosed during the study were without symptoms or asymptomatic. During the prevalence study, researchers found that 21% of patients with a positive anti-endomyosal antibody test could not receive a biopsy due to the refusal of their physician to perform the procedure or the insurance company to pay for it. Only 35% of newly diagnosed patients had chronic diarrhea, dispelling the myth that diarrhea must be present to diagnose celiac disease. A Source A multi-center study on the seroprevalence of celiac disease in the United States among both at-risk and not at-risk groups Celiac disease affects at least 3 million Americans. The average length of time it takes for a symptomatic person to be diagnosed with celiac disease in the United States is 4 years. The type of delay dramatically increases in individuals at risk for developing autoimmune disorders, neurological problems, osteoporosis, and even cancer. Diagnosis. Many people with celiac disease don't know they have it. Two blood tests can help diagnose it. Serology test looks for antibodies in your blood. Elevated levels of certain antibody proteins indicate immune reaction to gluten. Genetic testing for human leukocyte antigens can be used to rule out celiac disease. It is important to be tested for celiac disease before trying a gluten-free diet. Eliminating gluten from your diet might make the results of the blood test appear normal. If the results of these tests indicate celiac disease, your doctor will likely order one of the following tests: an endoscopy or a capsule endoscopy. Celiac disease treatment. So treatment consists of a gluten-free diet, vitamins and mineral supplements. People with celiac disease must exclude gluten from their diet because eating even small amounts may cause symptoms. The response to gluten-free diet is usually rapid, and the symptoms resolve in 1 to 2 weeks. Once gluten is avoided, the brush-like surface of the small intestines and its absorptive function return to normal. Doctors give most people with celiac supplements to replace vitamins such as folate and minerals such as iron that I discussed in the earlier slides. Another biopsy is done in 3 to 6 months after the gluten diet has been started. Sometimes children are seriously ill when first diagnosed and need a period of intravenous feeding before starting the gluten-free diet. Prognosis. The long-term outlook or the prognosis for people with celiac disease can vary because people have no symptoms while others have severe malabsorption features. Overall, people with untreated or unresponsive celiac disease have an increased early mortality compared to general population. Without diagnosis and treatment, celiac disease is ultimately fatal in 10 to 30% of people. Currently, this outcome is rare, and most people do well if they avoid gluten. Thanks for watching my slides. Have a great day.